All of us know that cervical cancer is a virus infection. 80% of women may be getting this infection.
How does a cancer cervix affect the quality of life based on the severity and when diagnosed and the treatment? So, how does it really affect?
Yeah, after 25, one can take it almost till the age of 40 years. Because boys can also get affected by the same virus. Sometimes the mothers have a fear that is it given vaginally, I didn't know that they had such fears. And all of you know that it is given in the upper arm like any other industry.
But why not about cancer cervix? People are not even aware. It's so common, and I've met a lot of people who are educated, affluent, who have not taken the shots. They don't know there is a vaccine available.
They do not realize that anybody can get cervical cancer. It is not familial, it's not genetic. Anybody can get it. How a woman is suffering and how her suffering can be prevented if she were vaccinated. If the daughter had vaccine or the mother had screening, perhaps you can prevent the disease. So, giving awareness is very important.
Welcome to Feminine Systems, the podcast where we not only heal and empower women, but also reimagine systems around her. I'm Dr. D, an integrative gynecologist, an author, and an entrepreneur. Today, we're talking about something that should be unremarkable, something every woman deserves, something we can eliminate, and yet we haven't. India bears the second highest burden of cancer cervix. Nearly 1 in 5 cancer cervix deaths globally happen in India. Almost 90% of these deaths are preventable just by simple vaccination and screening. Cancer cervix is a deadly disease which kills 1 woman in every 8 minutes in India. But we have not done anything to cure it or prevent it. Today, my guest for the Feminine System podcast is somebody who has stood at the cervix of lakhs of women, literally and symbolically. She's a senior gynecologist with over 40 years of experience. Dr. Asha R, the director of Rao Hospital, Coimbatore. She has chaired several national and international conferences and served as a past president of the Obstetrics and Gynaecology Society. And today, we are going to have her dissect about cancer cervix and how are we going to create a generation without cervical cancer and how India must act now going forward. Hi, Dr. Asha. Welcome to our podcast, Feminine Systems. It's a pleasure having you here.
Hi, Dipna.
So let's go to talk about this most preventable cancer of the women's reproductive system, which is called the cancer cervix. Can you recollect and tell us any particular incident where you detected this cancer cervix much earlier, which you didn't anticipate?
Cervical cancer, I think it's the best topic that you have chosen for today.
Yeah, thank you.
And yeah, I can tell you quite a few stories.
Okay.
And one of them, I would say, is one of my friends who came around the age of 45 or so. And she said she had missed her pap smear for a couple of years. She was pretty conscious of that. And a few years she had not done the pap smear. And when we did her pap smear, we saw abnormal cells. And then the biopsy proved that it was cervical cancer. Then she had to undergo a hysterectomy.
Okay.
But at the end of it, she was very happy because we had caught it at very early stage.
Yeah.
So she did not require any further radiotherapy or chemotherapy. And the other scenario is my watchman's daughter-in-law. She was only 32 years. And they brought her almost gasping.
Okay.
All that he told me was, Marumagalukku nadakka mudiyilla, moochu vaangudhu. Then when we examined her, we realized it was a case of terminal cervical cancer.
Okay.
She would have married at the age of 18 years or so. And now she was married for 14 years. And she was in terminal case of cervical cancer.
So early.
That was very sad,
Yeah.
Had they done some checkup earlier, such a young life could have been saved. That was the paradigm.
So early you get cancer cervix, ma'am?
Because the virus would have entered. Today, all of us know that cervical cancer is a virus infection.
Okay.
Just like polio or hepatitis. That is the hepatitis B jaundice, which are preventable. This is also a virus infection and comes by intimate contact.
Okay.
Either vaginal sex, oral, or anal. So, and 80% of women may be getting this infection, a mild infection, sometime or other in their life. But most of us are able to fight it out, and only a small percentage gets the disease.
Okay.
And it takes about 10 to 15 years for the for the disease to reach a terminal stage. And this lady being married for 14 years, perhaps possible that she got it from her husband.
Yeah.
And there was no checkup, no pap smear, nothing.
Correct.
So that was sad.
Oh, what are the symptoms of cancer cervix, doctor?
See, sometimes it can be totally asymptomatic, no symptoms at all. This is possible.
Okay.
That's why we insist on one regular checkup for a woman every year. And other common symptoms are a white discharge, which may be foul smelling, or sometimes there could be a streak of blood, or intermenstrual bleeding. Instead of 30-day cycle, you can have bleeding 10th day, 15th day, 20th day, irregular spotting between the month. And sometimes they can also have a bit of spotting or bleeding after sex.
Okay.
And women who stop bleeding at menopause, suddenly they start having a little bleeding after menopause. One has to look for either cervical cancer or endometrial cancer.
Okay. So that has to be taken very seriously.
Yes.
Yeah. Anytime after menopause.
So any abnormal white discharge or abnormal spotting, one has to go for a checkup.
Doctor, you told me that the HPV infection, as cancer cervix is a virus-caused infection, HPV infection takes years to develop. The HPV infection progressing into a cancer takes years to develop. How can we actually prevent it or how can we stop it? What are the tests we do have and what age somebody has to start taking these tests?
Yes. There are about 4 to 5 tests.
Okay.
The most important and simple one being pap smear. Pap smear is nothing but doctor takes a drop of vaginal discharge and puts it on a slide and is sent for examination. And just at a cost of 200 to 400 rupees, you can find out whether there are any precancerous cells. You can find it out before the cancer. And today we have tests called VIA, visual inspection with acetic acid. And we have HPV test, where you can detect if the virus is there in the body. So it's more accurate. And then we have colposcopy also.
Okay. What is that, colposcopy?
So whenever you get an abnormal pap smear from the vagina, you want to check from where it is coming.
Okay.
So a simple examination, the woman is made to lie down on the table and there is a small examination microscope. That means it just gives a magnification. So that is focused into the vagina.
So if the cervix looks abnormal or abnormal,
some medication called as iodine.
Okay.
And then you look for abnormal cells and you can take a few pictures.
Okay.
And then it can be studied better.
Okay.
So you can see from where you have to take the biopsy.
Okay.
So colposcopy tells you which is the abnormal area. So you can take a biopsy from the right place.
Got it. So how often the screening, like you said, pap smear and HPV DNA testing, how often and from when somebody should start screening?
See, ideally, according to, the Royal College of Britain, one has to start from the age of 21 years.
Okay.
I feel at least from the age of 25 years. You do it till the age of 75. But you do it every 3 years. The pap smear.
Okay.
And today the HPV test, which is more accurate, can be done every 5 years.
Okay.
And do not stop at menopause, definitely continue it.
Okay.
Because many women feel that once they reach menopause, they feel that they're not going to get problem anymore.
Correct.
But that's the time that they get the problem.
Correct. So it is like every 3 years at least people should consider having a gynec checkup and a pap smear done at the minimal. So, but according to
many women feel that if they have no symptoms, it's a waste going to the gynecologist.
Absolutely. They think most hospitals are just pushing patients to, kind of an unnecessary test.
And they have a fear that, the doctor does a test, she will say that something is wrong.
Something is abnormal. Okay.
And maybe they are telling it unnecessarily.
True.
And they should not have that fear.
And it's so saddening to know only 2% of Indian women ever have had a pap smear at all. So it could be because they're very fearful of the procedure. They assume if they've never been taking a pap smear earlier, they just become very fearful, and
they're sort of shy also.
They're shy also because they just it's
no, like my own friend. She did her ultrasound scan. She did blood tests. When you told her pap smear lie down on the table, she says, "Not today. I'll come some other day. I'm not mentally prepared." So there is nothing to be. It's such a simple test.
Got it.
And perhaps if the government tells, like the British days, where they send a card to the woman that you have to come for a checkup, maybe they will do it.
How does a cancer cervix affect the quality of life based on the severity and when diagnosed and the treatment? So how does it really affect?
Yes, I think one should understand how it can affect our lives. There is grade 0, 1, 2, 3, 4. And if you diagnose it in grade 0 or stage 1, the cure is complete and woman is completely cured. But if you diagnose it a little late, say even in stage 2, sometimes they will require perhaps radiotherapy. In later stages, they may require chemotherapy. It may not be even operable.
Correct.
It can spread to the neighboring organs like intestines, the urinary bladder. This is the sad thing, The bladder can get affected. They can have difficulty in passing motion, urine. And if they have to take radiotherapy, that itself can give rise to so many side effects. Correct. After radiotherapy, they can have burning, micturition, difficulty in passing urine, motion. No, it's quite a suffering.
Yeah, the surgery is a very elaborate.
Whereas if they do it in the early stage, the cure is complete. No further suffering. That's very important.
And the best part is, you can diagnose it much earlier because of this every 3-year screening.
Yes.
And very early we pick it. So we can have post-surgery. The patient can actually have a great quality of life if diagnosed early.
Because cervix is exposed to the outside. You can check it very easily with the hands. So the cancer screening is very easy.
Most people don't understand cervical cancer means what. They confuse them with cancer of the uterus or cancer of the vagina. So they really don't understand which part is this. So can you tell us more about that?
You can imagine the uterus is like a pear-shaped structure.
Okay.
So the cervix is the mouth of the uterus.
Okay.
And whenever somebody has sex, this is where there is a maybe perhaps exposure to virus or pressure on the cervix during sex. So, but you can examine it very easily by putting 2 fingers into the vagina. So it's very simple. I think we can always show them a picture of the uterus, vagina.
Yeah.
And it's very simple.
This is my favorite part of the podcast. It's a rapid fire. You can choose to answer in 1 word, 1 line, or true or false kind. Also, there are questions. So, and they are basically questions around the myths around cervical cancer. So, HPV is a sexually transmitted disease. So, only promiscuous women get it.
Not true.
Okay.
About 70 to 80% of women can get exposed to this virus.
Okay.
At any stage in life, but most of them fight it out.
Even in a monogamous
relation. It is transmitted by intimate contact, but not exactly a sexually transmitted disease.
Got it. If I'm vaccinated, I don't need screening again.
No, you have to do it because there are so many types of virus. And with vaccination, you can't can't kill every virus.
Correct.
So you have to do a screening, as I told. The same rule applies here also.
Correct. So that same 3 years, every 3 years, once keep screening, even if I'm vaccinated. Because I want the new viewers to know the vaccine, most of the vaccines what we take are, against some very, very commonly causing virus strains, which are only 4 types.
But actually there are 16, 18, 32, 33, 36.
More than 100 varieties of HPV are there. So it doesn't offer protection against all that. So if you're vaccinated, you're protected by the strains which cause cancer cervix most commonly, but still you need to keep screening. So this is something we want to emphasize.
And there is also another condition called as endometrial cancer. So you can, by doing a regular screening, you can diagnose that
as well. So these are the most common cancers of the genital tract of women. So only women with symptoms need to get checked.
I told you already that they may not have symptoms.
Yeah.
So one has to do the screening regularly and do not wait for the symptoms. When you get symptoms, it may be late.
Pap smear is painful.
No, it's such a simple examination.
It takes hardly a minute to get the test done. So many people fear this and they really don't want to go into a pap smear. Maybe they think we might do a biopsy directly. so it's a very non-painful test. There is...
Whenever a pregnant lady comes for a checkup, I tell the mother to do the screening.
Okay.
And you know what the woman says? I'll take my husband's permission and come.
Oh my God.
That's the giddy limit. This is how our Indian women try to escape.
They just try... a fear and the shyness.
They just want to postpone it.
Correct. They just want to postpone it. And they don't understand it's such a priority. And it's so common. Actually, they think, I might also not get it. Sometimes some women think it's some very rare disease. So I might not get it is what they think. So that is again I
tell them that even a scooter gets annual overhauling. Why not your body, which is so precious?
Brilliant, actually. So there is cure for HPV.
Yes, if diagnosed early, yes. Yeah. You can remove the affected part and cure the disease. But it's not curable medically. There are no antibiotics for that.
Got it. HPV vaccine works for boys too.
Yes, of course. Because boys can also get affected by the same virus. And they can get problems in the mouth, the rectum, the penis. So they have to, or they can even get warts on the private parts. So it is important to vaccinate the boys also. It is already started in many European countries. So we also have to do it.
Are we doing it in India? Do you see any?
Of late, I see from last year, I see that the pediatricians have started advocating and many pediatricians are giving it to the children.
For the boys.
Because the boys and girls are under the pediatrician almost till the age of 15 years.
Correct.
And this is, 9 to 14 is the right time to catch them.
Got it. Cancer cervix is genetic.
No, it's not. I told you it's a virus infection.
That's a rapid fire. So I wanted to just, reiterate it many times. And early stage of cancer cervix is silent.
Yes.
So there is no symptoms at all. It is
no
very
symptoms.
quiet.
So a regular checkup is very important.
Very important. The vaccine, HPV vaccine, affects fertility and has future side effects.
No, definitely not. There is no effect on fertility at all.
Okay. So many fear that.
My nieces, my sister's daughters were vaccinated in Australia about 20 years back.
Great.
And now those girls are around, I think, 35 years and they have had babies. So everything is fine.
And so let's talk about the vaccine, doctor. Like, what are the current vaccines available in our Indian market, and when is the right time for our children or our, adult women? When do they take, or the boys to take? So, can you tell about the doses and?
Yeah, vaccine is a simple injection. All of you know that it is given in the upper arm like any other injection, because sometimes the mothers have a fear that is it given vaginally? I didn't know that they had such fears. So it's a simple injection which is given in the upper arm.
Because we're giving a vaccine for cervix and people assume maybe we're going to directly give it to the cervix.
I know. Because
it is given in your arm.
A woman asked me once, how can you give it to a child in that area? I said, no, it is given in the upper arm like any other injection and there are no side effects. And the doctor should check that she has no cold, cough or some serious bacterial infection, which day you cannot give it. And there are two vaccines. One is called Gardasil and one is called Cervavac. This injection is typically given between the age of 9 to 14 years because immunity is very good that time. The response from the immune system is very fast. So that's the ideal time to give it. Today, WHO says that one injection of Gardasil is enough between the age of 9 to 14. And today they have extended up to 20 also, up to 20 years. That means 9 to 20 years you take single injection.
Up to 20.
But about 20, you need to take two injections. So, Gardasil, there is something called as quadrivalent. Quadri means 4. 4 virus can be controlled by quadrivalent, which costs around 4,000 rupees. And there is something called as nanovalent. Nano means 9 virus can be controlled. It costs around some 11,000 or so. But today, our friend Serum Institute of India, the one which brought such a brilliant vaccine for COVID. Same
correct.
company has brought Cervical. And here one dose costs only about 2,000. Today we are giving 2 doses of Cervical, but in future we may be giving only one dose. That means with a cost of 2,000, you can prevent the disease lifelong.
Absolutely. Cervical is a very indigenous Indian manufactured vaccine. So
we should be proud of our Indian companies.
Absolutely.
Not only the Indian drones, but the vaccines also.
Correct. You're correct. And if the vaccine has to be taken after, in some unmarried women after 25 or something, do you recommend it? And what are the precautions they need to take? Married and unmarried after 25.
Yeah, after 25, one can take it almost till the age of 40 years. The theory is like this. Occasionally, maybe the husband may have an extramarital sex. So you got some virus from him initially, but you can get new infection later. So if you're not vaccinated earlier, it is wiser to take the vaccination even later. There are, the government is, or our gynec society is advocating that you give it even after delivery. Because they come to you for delivery and they spend some money. So at the same time, if you can take the injection, it is good for them for the future. So if they have never taken vaccine earlier, give it even at the age of 25 to 35. No problem. But taking it after 40 is actually
not much
use at all.
Yeah. So if I'm going to get married in another 2 months and I'm taking the vaccine now, should I take any precaution for becoming pregnant?
When you take the vaccine, avoid pregnancy for 3 months. Otherwise, it's okay. So why I always see we've talked about other disorders so much, but why not about cancer cervix? People are not even aware. It's so common, and I've met a lot of people who are educated, affluent, who have not taken the shots. They don't know there is a vaccine available, and they think this cancer cervix is something which they might not even get. It's not running in our families. I know. So one is ignorance, They do not realize that anybody can get cervical cancer. It is not familial. It's not genetic. Anybody can get it. Number 2, there are, like you said, there are not many talks going on about cervical cancer because I think cancer or how this cancer comes through sex, all are forbidden topics.
Correct.
Women do not discuss sexuality, that cervical cancer can come through sex. When you tell them that your daughter should be vaccinated, preferably before the age of sex, before the virus enters, you keep this defense system, the drones ready, the vaccine drones. But they feel that, my daughter will not have sex before marriage, which is not true. Any child can have.
In today's world, it is not true.
Yeah, you cannot have a.
Correct. People get married very late.
Yeah, true. And it's wiser to catch them young. So whenever they are with the pediatrician, I think between the age of 9 to 15, it's the ideal time to give it. And it's our duty to, give this awareness to the couples and the children also. We have started going to the schools, talk to them, colleges, talk to them. And WHO has got this protocol today, which they call as 90-70-90.
90-70-90.
Yeah.
Okay.
So they want to vaccinate 90% of the girls before the age of 15.
Okay.
And they want to reach at least, screen at least 70% of women by pap smears. Okay. And again, they want to treat 90% of women who are affected. So during screening, if you find out that there is a problem, treat it. So this is by 2030. It should be a cervical cancer-free world. Okay. See, we are all Rotarians. And the Rotary is the one who eradicated polio. So
Absolutely.
Just like that today, we want to eradicate cervical cancer. So we doctors are joining hands with Rotary. I'm a Rotarian, I'm a doctor. So last few years, we have been doing lots of work for screening. And last year, we launched the program for free vaccination.
Okay.
And from our hospital also, we gave more than 200 doses free.
Okay.
And other hospitals also have started doing it. And looks like this year now the government also has launched doing free vaccination between the age of 9 to 14. But still there is a void, the girls above 15 who are not vaccinated, government is not going to give it free. So still there is a role where Rotary can do something about vaccination.
The problem is even when it is given free 9 to 15, many are not willing to take. That is what I'm hearing.
True.
they feel we can avoid it. We are not going to get. So this is also a stigma where.
So creating awareness is very important.
Very, very important. And
so not only doctor, even all this, the Rotary Lions, everybody can spread the awareness.
Can be part of this. Doctor, can you tell me more about any particular group of women who are at a high risk of developing cancer cervix? Do you think any risk factors are there?
No. Number one is early marriage means early exposure to the virus through the partner, and multiple partners or husband having multiple partners. That also is your risk,
Yeah.
The other one is HIV infected people also have a higher risk of cervical cancer. And they can get it more rapidly than others because their immunity is low.
Some women have asked me this, if they use any intrauterine devices for contraception, they are at a higher risk of developing cancer cervix. So what are your comments on that?
No, definitely no. On the other side, perhaps you use a barrier contraception like condom, the risk is less.
True.
Because the cervix is not exposed to virus. But putting a IUCD does not increase the chances. And not everybody likes the barrier contraception anyway.
So if we want to design a care ritual system around cancer cervix and make changes in the health policies and protocols, what would you suggest our government to consider?
No, number one, I told you already the WHO protocols are going to be 90,
so they have
70,
taken
90.
it very seriously and going to make it mandatory.
Vaccinate the daughters because the government is starting to give free vaccination now. So vaccinate the daughters and screen the moms. This is very important. So I think when you give a ration card, you should tell them you're entitled for one checkup every year.
Correct.
It is free.
Free, correct.
And give them a reminder. This is very important. It can be either their birthday or wedding anniversary. They can just sort of, earmark something. Or daughter delivery. So grandchild's birthday.
Right.
Go and do an annual checkup. Look for diabetes, hypertension, cervical cancer. Everything can be done one shot.
Please note this, just screening for a cancer cervix can be one of the best birthday gift you can give your spouse. Or if you have a daughter, getting the shot, cervical cancer vaccine shot is actually a great gift. So I think we should be creating maybe or some reminders.
And for your own daughter, let us start with our own children. A birthday gift can be a cervical cancer vaccination.
Absolutely. And see what...
And maybe a new daughter-in-law can, in future, they can tell the in-laws, this is time for your health checkup.
Absolutely.
Give a birthday gift to the mother-in-law, a coupon.
So be an ally for every woman out there where we can actually prevent this, achieve this 90% reduction of, cancer cervix because it is vaccine preventable. So we have certain... Women actually are very ritualistic and they do, for instance, meticulously follow this Karwa Chauth.
I know.
And, this Varalakshmi Nom in Tamil Nadu. So when they kind of, care so much about their well-being of their husbands and do so much, I think there should be something, ritual.
Maybe the husband can give her a gift on that day.
They should.
This is for your health checkup.
Exactly. Why don't they even tie that to such an occasion where the wife is ready to fast, make prayers,
and all the friends can together take a decision. This Karwa Chauth or this Varalakshmi Puja, we are going for our health checkup. Especially go get a pap smear done. Very simple, non-painful. So these are things which I think we should inculcate in a society and support the women in our lives. And we all know we are not wired for prevention because we are actually known, human mind is wired to act in crisis, never for prevention. So what is that one shift if you could make systematically in your hospital? There are every day hundreds of patients walking in. So what is that something you could really radically change, though it is not a recommendation or protocol by RCOG, ICOG and all that. But what is that you might consider doing? Number one is awareness.
Okay.
There are so many TVs running in every hospital.
Right.
Start putting programs on cervical cancer. How a woman is suffering and how her suffering can be prevented if she were vaccinated or if the daughter had vaccine or the mother had screening. Perhaps you can prevent the disease. So giving awareness is very important. And every time a woman comes to me for a checkup, the girl comes for a checkup, pregnancy checkup, I tell the mother, look, this is your discount coupon. Do a checkup.
Okay.
And they should not have a feeling that, oh, this is for the doctor to make money. I mean, this is the anxiety that all of them have.
Yeah.
But slowly, I think we have to build the confidence that it is for their good.
Is there any way we can make pap smear mandatory in our practice, doctor? So is it possible at all? Or is it like
nothing
forcing?
Can be known. In India, is free. You cannot enforce anything on anybody.
Correct.
But I told you, like with the, they can have a pre-employment vaccination.
Correct.
If the girls are going for a job by the age of 19, 20, they can if they're not done it earlier, they can have a vaccination that time.
Yeah.
And if they're married, and they can still think of either vaccination or screening. And all birthdays should be celebrated by giving the women some pocket money for their health.
Correct. So many of the time, women are not primary decision makers for their own health. They don't have the finances to spend on them because they're dependent on.
That's how they say, I'll ask my husband and come. I'll ask my son and come. So they don't have to do that.
Yeah, right. So, but maybe I'm very unrealistic that,
even today they are getting a pap smear free in the government hospitals.
Absolutely.
But they won't go.
But they're not taking it there.
The fear and the stigma, both.
Yeah. So maybe I'm over ambitious, or maybe
the more you talk about it, more you create awareness, I think they are going to improve.
But I think I'm over ambitious there. I always feel a woman should deserve care should be like, awaiting a woman in anticipation.
Their birth
rather than just make them aware and take it by option. It has to be an integral part of preventive.
It has to be compulsory.
Healthcare is a very integral part of our healthcare system. So maybe that is my wish for the society and for the Indian healthcare system to evolve into. And so any message.
No, but if you look at it, the Indian government policies are better than the Western. There, without insurance, I think you are going to die many times.
Correct.
But here, so many things are done free, even in the government hospitals.
Our patients are not utilizing them.
They're not. The awareness is not there.
Not there. Right. So, I think we are almost at the close of our
awareness, vaccinate the daughters, and screen the moms. This is going to be a mantra for the future.
Great. Thank you so much, Dr. Asha, for your wisdom, your work, and the fierce care you deliver all the women. And I've known you as a person with a lot of passion for women who have been serving for over 40 years. And it's such an honor to have you on our show.
Thank you so much, Dee.
Yeah, thank you, Asha.
Having called me here so that I can sort of talk to everyone about this.
Yeah. So, and we'll make... cancer cervix, we can eradicate cancer cervix from India, which is a possibility, and it is not at all a dream. It can be achieved. So please do like and share this video to all the women and the men who so that such an important message gets passed on. And thank you so much for viewing this channel till the end. Thank you so much.
And you as a doctor and Rotarian are doing a wonderful job.
And thank you, ma'am. Thank you so much. Thank you.